Today we're going to talk about the right to health. Behind me is the Ronald McDonald House, and then down the street that way just a little ways we have the Children's Hospital and the University of Iowa Hospital Complex. Now when we think about health, we often think about hospitals and access to health care. And while that is an important part of the component of the right to health, health is so much bigger than just healthcare. Health is a complete state of physical, mental, and social well-being, not just the absence of disease. Health is a fundamental human right, and that should be achievable by everyone, no matter who they are. Now, one thing that's important that we've explored a bit already in class is how a wide variety of factors at a broad range of levels affect health. One way of thinking about this is called the social ecological model. The social ecological model is a tool to understand dynamics and interaction between factors at a range of levels. Sometimes the levels use different terms to describe them, but in this particular model that we'll use in class, the levels are called individual, relationship, community, and societal. For example, it's well known that getting adequate exercise is important to your health. Choosing to get daily exercise is an individual level factor. However, if you live in a community that doesn't have safe sidewalks or a place to exercise, then you won't be able to achieve that individual goal of exercising. And that way, the community factor limited your ability to achieve your goal of exercising. There are a whole range of these sorts of factors that influence your health. These are often called social determinants of health. These are the social conditions such as education access, healthcare access, neighborhoods, social and community context, and economic stability that affect a wide range of health risks and outcomes. For example, healthy eating. Was there a store nearby with fresh fruits and vegetables? Would some of those fresh fruits and vegetables make you sick? Was it easy to get clean drinking water? Did your school educate you about which foods are most healthy? Did you have a refrigerator and cooking appliances in your home? Did you take classes on how to prepare healthy meals? These are all important determinants of your ability to eat healthy, but are often out of your personal control. Now, looking at the research data, we see these social determinants showing up everywhere in health data. For instance, in life expectancy, we see those with the most education having the highest life expectancy, 85.3 years for women with a college degree versus only 82 years for women with only a high school diploma. We also see it with race, where black and poor infants in the United States have much worse health outcomes than their wealthier and non-black peers. And globally, there are huge inequities in child health around the world, primarily due to these social determinants of health. As of 2023, around 13,000 children under the age of 5 died every day, around 4.8 million globally. The world has made tremendous progress since 1990, with a 61% reduction in annual deaths from 1990 to 2023 in children. But that progress is not inevitable and requires ongoing effort and targeted interventions in parts of the world that continue to have extremely high death rates for children. If we look at the top causes of death for children at age 4 and under, we see many of them can be prevented with access to vaccines, such as respiratory infections, diarrheal diseases, infectious conditions, malaria, measles, tetanus, and hopefully soon HIV. Sadly, resistance to vaccines and misinformation has produced an increase in some of these diseases, with some cases of diseases showing up in Iowa even for the very first time in decades. Other global strategies for reducing child mortality include prenatal, maternal, and delivery care, such as reducing tobacco and substance use, reducing unwanted pregnancies, and providing effective care to mother and baby at birth. And community interventions, such as clean water, safe streets, disease prevention, and safe food strategies also address many of these top causes of mortality in children around the world. And of course, healthcare is an important aspect of being healthy, yet too many people can have difficulty accessing the care they need. In the United States, nearly half of the children with a treatable mental illness did not receive any treatment from a mental health professional. I had to restart the video because it got too hot in my car for the phone to operate. Never had that happen before. So anyway, efforts to improve healthcare access, including mental health care, is critically important to improve health for children. To summarize, the right to health begins with the right to adequate food and the right to adequate shelter. The right to health can be difficult to achieve on your own and requires a broad range of relationship, community, and societal factors, often defined as social determinants of health, to be in place for people to achieve their maximal physical, mental, and social well-being. For your assignment, I'm going to ask you to reflect on a scenario that occurred in Ohio about 10 years ago. A 12-year-old girl named Sarah Hirschberger was diagnosed with lymphoblastic lymphoma, a type of cancer. The standard of care is multiple rounds of chemotherapy, which at that time had a success rate of around 85% for full remission. Now, after the first 2 rounds of treatment, her family did not like the side effects of chemotherapy, as chemotherapy can produce some difficult side effects, and decided they wanted to stop treatment even though there were many additional rounds of chemotherapy that were required for the standard treatment plan. So the family stopped bringing Sarah to the chemotherapy therapy appointments. It was clear from interviews the family did want Sarah to get better and loved her. It wasn't a neglect situation, but they just didn't like the chemotherapy. My reflection question is, if you were the doctor treating Sarah, what would you do? Do the parents have the ultimate ability to decide what treatments their children can access, even if the lack of treatment might lead to her death? Or does the state have a responsibility to intervene? And more broadly, when, if ever, does a child's right to be healthy outweigh a parent's right to make healthcare decisions? Okay, next, I'd like to think about the question of healthcare and politics. Health is very political. 2 of the biggest killers in the U.S. are firearms and vehicle crashes. The U.S. death rate from firearms is among the highest in the world and 8 times higher than the death rate in Canada. Yet, political discussions about reducing gun violence are often a political non-starter. Similarly, making roads safer and cars safer is seen as too expensive, and it's easier to blame poor driving, yet many deaths could be avoided by changing our roads, policies, and vehicles. If health is a right, does that change how we talk about firearms and road deaths? Then finally, what are some career or volunteer opportunities you might consider that address children's right to health? What might be of interest to you, if any, and why? Thank you, and see you in class.